do not protect your heart, closing it off to others and your opportunity to experience real love is what I usually have to say. But in this instance, you absolutely need to protect your heart. This is the one instance I'll say that. Do you have cancer, and will you be on, or are you on, a type of chemo that damages the heart? It's unlikely your oncologist would even let you know unless you're like a super high risk perhaps. But you do deserve to know, so you know how to protect your precious heart, and I'll show you how. Hi, I'm Dr. Lisa Matejka, and I help women in their 40s to 60s with cancer who are paralyzed by fear, drowning in conflicting advice, and unsure what steps to take next to regain their emotional center, inner strength, and personal power. By guiding them through a truly innovative and comprehensive holistic system, they are empowered to pursue a path where the odds of a full and deeper healing are likely to occur. I am a naturopathic physician, oftentimes assisting women with cancer who are undergoing conventional treatment. In these cases, I focus on protecting their body from damage, minimizing side effects, and synergizing naturopathic options with the conventional treatments, thereby providing their body with an incredible advantage over cancer. All right, first things first, which drugs do we need to watch out for? So there's a class of chemo drugs known as anthracyclines. Anthracyclines are the ones that are known to be cardiotoxic, aka damaging to the heart. And these include the drugs doxorubicin, also known as adriamycin, daunorubicin, epirubicin, and idarubicin. Some people say idarubicin. Those are the main ones. Anything under the class of anthracyclines, though, with the ones I just named being the most common ones. So it's important for everybody on these drugs to protect your heart, but especially if you have any sort of cardiovascular history, cardiovascular events, or cardiovascular risk factors, including things like obesity, high blood pressure, high cholesterol, diabetes, smoking, and over the age of 60. So everything I'm about to tell you, by the way, is backed by research studies and accepted to be true by integrative oncologists and whatnot. Backed by research studies. And I'll get into the different categories of things that can help: nutrition, exercise, supplements, mind-body stuff. And then I'll share a couple extra things beyond this research that I have found to be helpful, and also some things you can do if you already have some cardiotoxicity from these chemo drugs. Okay, so oftentimes we start with the boring or kind of like duh things first. So, and it's because it's important. So a fundamental is minimizing risk. So in the category of minimizing risk, you want to be sure you're not doing things to stress your heart or taking things that stresses your heart. Drugs and things like cocaine, caffeinated energy drinks, performance enhancing drugs, diet pills, ephedra, known as Huang. And also just, minimizing those risk factors that I just talked about. So if you smoke, quit smoking. If you're a bit overweight, consider losing weight, things of that nature. All right, category of diet. So the Mediterranean diet is known to be one of the best studied diets for cancer. And it just so happens it is also a very heart-healthy diet. So here is basically an image of what the Mediterranean diet looks like, essentially. I'm not going to get too into exactly what it is. But the cool thing about the Mediterranean diet, it is a heart-healthy diet, so it has been shown to lower blood pressure, control glucose, control cholesterol, and also lends to a healthy weight. And as far as cancer goes, it's known as being a good not only preventive diet, but in people who already have cancer, it increases survival. So the study relevant to protecting your heart, it says, and specifically with the anthracyclines, so for women in the study who had anthracycline chemotherapy, they ate 4 to 5 servings of fruits and vegetables per day, more than 3 servings of whole grains daily, fish more than twice per week, and 2 to 6 servings of healthy vegetable oil, such as olive oil. And this helped reduce heart-related side effects from that chemo and improved the quality of their life. And these habits, these servings I just mentioned, very closely resemble the Mediterranean diet. The next is exercise. Exercise is pretty obviously known for being good for the heart as well as many other things. But in this particular study of patients, cancer patients undergoing anthracycline therapy, the conclusion of the study was that staying active may prevent physical decline and improve heart function. It also happened to reduce fatigue. So what does exercise mean? What are we talking about here? So for cancer patients, it's recommended to do 150 minutes of moderate aerobic activity per week or 75 minutes of vigorous aerobic activity per week. Okay, so what is that? So for the 150 minutes of moderate intensity exercise of an aerobic nature, that means your breathing and heart rate go up a little bit. So brisk walking, it has to be brisk, not regular walking. Cycling on flat ground, maybe some swimming. Vigorous intensity means your breathing and heart rate go up a lot. So jogging, running, uphill cycling, maybe more intense forms of swimming. And it's also a good idea to add in some strength training as well. And you can also mix and match the moderate and the vigorous to meet the goal. And yes, it is good for cancer patients to exercise. I know it's a common thing where they're like, oh, but I'm fatigued and I don't have the energy for the exercise. But the thing is, if you can just kind of I don't want to say force yourself, but yes, if you can kind of just lead yourself to do it anyways, you find that you do end up feeling better, more energized, and just all in all better. And it doesn't have to be like crazy gym workouts, a brisk walk. And then, of course, my favorite category, mental emotional wellness and stress management. So there has been proved to be a link between mental health and heart health. In these particular studies, they note things like going to support groups, which is recommended in cancer, support groups, counseling, therapy, relaxation techniques, and meditation techniques. Also widely studied is green spaces, also known as forest bathing, or just being in nature, green spaces. So I always recommend get into nature, as deep as you can. Otherwise, it's perfectly acceptable and good to just go to a local park or garden. Green spaces, these have been widely shown to protect the heart, to reduce the risk of death from heart disease, to reduce the risk of stroke, high cholesterol, diabetes, and to actively, in that moment of being there, lower heart rate, stress hormones, and blood pressure. Also, these are things that are shown in studies, but I have quite the arsenal of things that help mental, emotional health and stress. So I would venture that there's even a lot more that can be done. Things that I can't say I have studies for, but that I have been shown to work in my experience are things like journaling, really anything that brings the person some joy or meaning, a plethora of modalities that help to release emotions, help with that letting go process, help with mindset, whether they're actual techniques or coaching or programs, courses, and energy work, and all kinds of stuff really can help in this arena. Now to the big category of supplements. What kind of supplements can we take to protect the heart from anthracyclines? So fish oil has been shown to protect the heart even in children that are taking doxorubicin. So milk thistle is also shown to protect the heart and reduce cardio-toxicity in children taking doxorubicin. Turns out that milk thistle and doxorubicin are actually synergistic and work really well together, and it's protective of the heart. Other things that happen to be synergistic with doxorubicin are vitamin C and glutathione, by the way, but you might have to get IV or take NAC. And milk thistle is safe to take with chemo. There's no interaction, so it's a good safe one to take. Iodine. Iodine has been shown to reduce the levels of heart distress enzymes in women undergoing epirubicin chemotherapy. Astragalus and turmeric tea may improve heart function in women undergoing anthracycline type chemotherapies. And a note on curcuma longa, turmeric known as curcuma longa. This is from a different study. It improves left ventricular function in age-related left ventricular dysfunction. So this is just showing how it's good for the heart in general. And that dose in the study anyway happened to be 150 milligrams of curcumin a day. Again, see your holistic health professional, your naturopathic doctor, to see which of these, if any, are safe for you and what dose you should be taking. So black cumin seed oil, which is a different species, black cumin seed oil is actually a known thing that's good to take for cancer, but it has been shown to help protect the heart in children undergoing doxorubicin therapy. And just because some of these studies are on children doesn't mean, like, if it's safe for children, it's safe for adults. If it's good for children, it's typically good for adults too. Actually, that study showed that the black cumin seed oil improved heart function in children undergoing doxorubicin therapy. Panax ginseng. Panax ginseng has been shown and may help women who are taking doxorubicin to improve their heart function. So ginkgo. Ginkgo may help to maintain a normal echocardiogram following treatments. An echocardiogram is like imaging of the heart. So, and a safety note, there may be increased bleeding risk when taking ginkgo. So definitely you should not be taking ginkgo if you're on medications that act as blood thinners or even aspirin. And ginkgo biloba, in another study, it also preserves normal EKG when taken with doxorubicin. So not only can ginkgo help maintain normal echoes, which is like an ultrasound of the heart, but also normal EKGs, which is where they attach the electrodes, preserves those normal tests. And that dose in the study anyways was 120 milligrams twice daily or less. But again, dosing is really going to depend on you, and ask your holistic health professional. CoQ10. CoQ10 is a good one. CoQ10 prevents oxidative stress in the mitochondria when on anthracyclines, and a study with doxorubicin showed that it may preserve heart function. It is known to be cardioprotective, and it also can prevent fatigue with these chemo drugs, and the dose is usually 100 to 300 milligrams a day. Chinese herbal medicine. Okay, there's a bunch of Chinese herbs, so I don't have the lowdown on exactly which ones, but studies have shown that some Chinese herbal therapies can be great for preventing heart damage, even preventing heart failure. And yes, that's specifically with the anthracycline therapy. All of these studies are, just to be clear. Another herb that's just known in the naturopathic world as being like the heart herb, as being a very good for the heart herb, cardioprotective and whatnot, is hawthorn. Crataegus oxycantha, hawthorn. And this can be up to 1,800 milligrams a day. Again, you need to see your own special naturopath or holistic health professional or herbalist or whatever to see, which of these supplements or therapies would be best suited for you and which are safe for you. Other good supplements that are good for the heart, cardioprotective, melatonin. Melatonin prevents oxidative damage of the heart when undergoing anthracycline therapy. Another good one that was also studied with anthracycline therapy is L-carnitine. L-carnitine protects from DNA damage, protects the mitochondria, and protects from lipid peroxidation. Now, what if you already have been taking doxorubicin, adriamycin, epirubicin, daunorubicin, any of these anthracyclines? What if you've already been taking them for a while and haven't been doing anything to protect your heart? Well, It's not too late to start. Start with some of these things. If you already have some heart damage, maybe from these, maybe you're getting, more of an abnormal EKG or something showing up on the echo. There are some things you can take for already having some active cardiotoxicity, some active heart damage. And a word of caution here, you really shouldn't just be treating yourself. You need to have a naturopathic doctor or some sort of holistic doctor, some sort of holistic professional that can guide you as to which, supplements you should be taking, because there might be interactions with some other stuff that you're on, or there might be, depending on your other health conditions, certain things might not be good for you to take. So this video is really just informational purposes only, and seek your own professional to give you the exact individualized care and advice for you, as well as dosing. But here are some things just for those that are interested that can help an actively damaged heart. And one of those is hawthorn. Again, hawthorn, Crataegus oxycantha, is a really great herb for the heart. Another one is lily of the valley, Convallaria majus. And the homeopathic Naja tripudens, I don't even know if I said that right, Naja tripudens, 6CH specifically the dose. That homeopathic can also be good. Then after that, we want to consider things like L-carnitine, vitamin E, CoQ10, taurine, even things like metformin. It's an off-label use of that drug. Oh, and the adaptogen herb, rhodiola. So there you have it, some ways to protect your heart. Some ways to protect your heart if you are undergoing the chemotherapy class of drugs known as anthracyclines, including the most popular ones, doxorubicin, adriamycin, daunorubicin, epirubicin, idarubicin. So hope that was very informational for you. And if you have any more questions, feel free to leave them in the comments. Be sure to share this with anyone else you think would be helpful. Like, subscribe, follow, all that good stuff. And check us out next month for naturopathic ways to deal with conventional treatment. Bye, everybody. Much love.